It's time for Access the Experts from the University of Nebraska at Omaha with your host, Brandon Axamit.
Hello and welcome to another edition of Access the Experts on News Channel Nebraska, where every Tuesday and Thursday, University of Nebraska at Omaha faculty members answer today's questions facing our state. Today we have the pleasure of hearing from Dr. Charmayne Adams, who is an assistant professor at UNO. Today we are focusing on mental health, with September being National Suicide Prevention Month. So Charmayne, the question is, what are the signs someone might be thinking of suicide, and who should a person reach out to if they're concerned about a friend or family member?
Hi, Brandon. Thank you for your question. Talking about suicide or death by suicide can produce a lot of anxiety. Having information about the warning signs and who you can reach out to if you're worried about a loved one can help you feel more empowered to reach out if you're worried about someone in your life. First, there is not one single warning sign if somebody is thinking about harming themselves or killing themselves. There's a variety of direct and indirect verbal signs, behavioral signs, and situational clues that may indicate that someone is thinking about harming themselves or killing themselves. The more clues someone provides, the greater risk they are at. The direct verbal signs are things like, are pretty obvious statements like, I wish I was dead, or I just don't think I can go on living. The indirect verbal signs are a little bit more vague. They're things like, I wish I could go to sleep and not wake up, or I don't think I can handle this anymore. Behavioral signs include things like isolating or giving away belongings, especially if those belongings are prized possessions. And finally, those situational clues, which we often hear in the newspaper or on the news, are those big things like breakups with a partner or being fired from a job. I want to stress that there is not one cause that would make someone think about killing themselves or hurting themselves. It is a myth that by asking someone if they're thinking about suicide, that it'll increase their chances with following through with their plan. In fact, the research shows the opposite. When we approach someone in a caring way and we ask them if they're thinking about harming themselves, we tell them that we see that they're struggling, we see the pain that they're in, it opens up a door for them to be honest with us about what's happening for them and what they may need. There's a variety of resources, both locally and nationally, that we can reach out to for both prevention and if we know someone in need right now. The National Foundation for Suicide Prevention has a lot of resources on their website, especially for high-risk groups like those in the LGBTQI+ community. There's also a national crisis phone line, 1-800-273-TALK, and a text line, 741-741. The Nebraska Family Helpline also has a line for you to reach out to in nebraskamentalhealth.com. There's a variety of low-cost counseling services in the community, and if you'd like more information, you can get that at unomaha.edu.
Well, thank you so much, Charmayne, for sharing your expertise on such an important topic. For our viewers at home, do not forget that Access the Experts airs every Tuesday and Thursday at 6:46 a.m. and p.m. only on News Channel Nebraska. For our next edition of Access the Experts on Tuesday, we will hear from Dr. Christopher Decker, and we'll be talking sports and the economic impact the state has seen due to a majority of sports being postponed or canceled this fall. Lastly, do not forget, if you have a question you want answered, submit it at newschannelnebraska.com. We'll see you next time.
Access the Experts, presented by the University of Nebraska at Omaha. If you have questions, submit them on our website. Then join us every Tuesday and Thursdays at 6:46 a.m. and p.m. while we answer your questions.